I'm a urologist, uro-oncologist, which means I deal with cancers of the urinary system. That means anywhere from the kidney, the urine pipes, the urinary bladder, and the prostate. Urology has been at the forefront of robotic surgery. What they wanted was some kind of machine which will be able to operate on the battlefield. Over the last 20 years, more than 6 to 7 million robotic surgeries have been done across the world.
Hello there. Today we have with us uro-oncologist Dr. Vivek Venkat. Welcome to the show, doctor.
Thank you, Pooja.
So first of all, we would like to know what is robotic surgery and what is the background?
Okay. So first of all, thank you for this opportunity. And when robotic surgery was introduced, it was an idea conceptualized by the Department of Defense, because what they wanted was some kind of machine which will be able to operate on the battlefield for any injured soldiers while the doctors are safe away from the war zone. So that was the whole idea by which robotic surgery was developed. Sorry. Unfortunately, that idea didn't quite pan out, but this technology was used and it is now translated into one of the most advanced surgical platforms that is available today. So robot basically means slave. So it's not that the robot is automatically doing the surgery on itself. The robot is basically the slave of the surgeon. So I'm sitting at a console which is about 10-12 feet away from the bedside of the patient. The patient is lying on the normal operating table, and there are instruments which have been placed into the patient's body, which I have done myself. And then there is a nurse and an assistant at the bedside. And then I take my place at the console where there are joysticks, and through that I control the instruments that have been docked into the patient. So this is why it's called a slave system or a robotic system. It doesn't have a mind of its own. It doesn't operate, autonomously. It's purely under the control of the surgeon. The advantage of the robotic system is that there is a great magnification of what we see, almost 10 to 12 times compared to the traditional approaches, and it has got wristed instruments. So when you are moving inside small places like the human body where the pelvis is, where there's really not much space to operate, putting the whole hand of the surgeon becomes very tricky. So we have these small instruments which go through an incision less than the size of my finger, so 7-8 millimeter instruments. They go deep into the body and they can do very complex and very precise work. So that is the advantage, and over the last 20 years, more than 6 to 7 million robotic surgeries have been done across the world, and the technology is improving. Every few years we get a new system which has got an upgrade on the previous one, and so I think there's no doubt this is the future of surgery.
So what is the entire procedure which is performed from start to end in robotic surgery?
So there are a number of procedures which can be performed robotically. The main procedure, because I'm a urologist, uro-oncologist, which means I deal with cancers of the urinary system. That means anywhere from the kidney, the urine pipes, the ureter, the bladder, the urinary bladder, and the prostate. So over the last 15-20 years, urology has been at the forefront of robotic surgery, and urologic cancers, which is what I talked about, they are maximally treated nowadays with a robotic approach. Because like I said, the organs which we deal with can be difficult to access in traditional forms of surgery. Like I said, putting the hand deep in the pelvis is difficult, doing microscopic, very fine suturing is difficult. All these things are made much more possible by the robotic approach, and it gives a great advantage to the patient, because we used to have to take big incisions on the abdomen. The recovery would be slow. The patient would be in the hospital for a week or two after the surgery, and nowadays we are able to discharge within 3 to 5 days in most cases. So these were big operations which were done open in the last till the last 15-20 years, but robotic surgery has revolutionized and given us a very good minimally invasive option for such cases.
And what is the cost of the surgery? Is it like cost efficient for
Right.
all sort of patients from all categories?
So that's the $1 million question, literally, because robotic surgery initially it did start out as more expensive as compared to the traditional forms. So even today it would be about 30 to 40% more than what would be the traditional laparoscopy or open surgeries. But however, you must take into account that the complications of robotic surgery are less, so the future costs that our patient may get would be lesser. Second, you're discharging the patient often much faster, so you're saving some days of stay in the hospital, which again adds to the expense. And the with each new version of the robot, the costs are also coming down. Until now, there was a big monopoly in terms of the Da Vinci system or the intuitive surgical system. So it was difficult to compete on cost. But nowadays there are new robots also coming up. I expect that in next 3-4 years we will be having multiple systems on the market. So that will also help to reduce the cost. So these are few things. It's about 30 to 50% more than what is the standard, but there are long-term savings and it helps to improve the patient outcomes. So I think it's worth the cost.
So this surgery is covered under insurance?
So that's a great question, because till about 2 or 3 years ago it wasn't covered. So the patient had to bear the extra expenses of the robotic system. But in 2022 there was a circular by the IRDA, which is the national authority, saying that insurance companies do have to cover robotic surgery, and there are very specific indications sometimes for cancers especially, they have said that. But however, as we know, insurance companies often try to find a way, to reject the claims. But we have the circular. If the doctor and the patient are a little proactive, we can give a written explanation as to why robotic surgery was recommended in this case, and oftentimes it will get covered. But each person would need to know their specific policy, because sometimes there's a limit on what how much of the robotic surgery the specific insurance package would cover. So read the policy, but don't give up, and just listen to the first answer from the insurance. Get a letter from the doctor, and they would often be able to cover a lot of it.
This is important information.
Yeah.
So how long a patient has to stay in the hospital during the surgery?
Right. So it depends on what kind of surgery we do. I'll speak about radical prostatectomy, which is a surgery where we remove the whole prostate for cancer of the prostate. So in that situation, in the old times when we had to do it open, till about 15-20 years ago, this was the most standard way of doing it. There was a lot of risk of bleeding in this procedure, and the patients would stay in the hospital at least a week or two after the surgery. So it was quite a major, sometimes difficult surgery. But now with the robotic approach, most patients in the US where I was, we used to send the patient home next day, because their staying in the hospital really adds a lot to the bill. But in India, because our patients would rather stay for 2-3 days till they are very comfortable to go home
and relax.
Yes, and then there's no worry about rushing back to the hospital. The driving on these roads and things
with
like
potholes
that.
And all.
Exactly. So they would rather stay for 2-3 days. So generally, most patients would be discharged within 3 to 4 days of this whole surgery. So this is for a major kidney cancer operation or for the prostate cancer operations. And what I just wanted to say about radical prostatectomy was, today more than 90% of this surgery is done robotically in the West, and even in India that number is probably close to that. Previously, surgeons would shy away from doing this surgery because it was so complex and had a risk of complications. But nowadays that has changed, and we are doing this surgery much better and much more advantageous for the patient, and the recovery is faster, complications are less. And because the prostate is in such a position where it's deep down inside the pelvis of the man, and we have to, after removing it, join the bladder down to the urine passage. So that used to be very tough when you did it open. But with the robotic surgery, we have wristed instruments which go like 360 degrees. Okay, so open and with a laparoscopy, we used to have to do it just, like right and left and up and down. So the freedom of movement is much more with robotic surgery. The magnification is excellent. You can actually see what you are stitching up. So it really makes a big difference for these particular surgeries for kidney cancer and prostate cancer.
So after the discharge, after how many days the patient is back to normal to
Right.
perform the routine activities?
Yes. So, most patients will be having liquids by the same evening. Within 6 to 8 hours of surgery. They should be walking or at least sitting up the same day. Next day, definitely they'll be walking. And once they go home, they are able to do their basic activities of taking care of themselves. They can have showers. They'll be walking as much as they want. They can eat. Most of them after the prostate surgery would have a urine catheter or a bag for about a week or 10 days. So once that is removed, then they would be pretty much back to normal. And in terms of the only restriction we give is that for about a month not to lift more than 5 or 6 kilos of weights, so that the incisions, even though they are small, the incisions on the abdomen take that much time to heal. So we don't want them to strain the abdomen. But walking as much as they want is fine. No strenuous exercise. That's the only thing for about a month. Just to say that after this prostate surgery, all men usually have some amount of urine leakage. Okay, so with newer techniques, robotic surgery has reduced the time it takes for that leakage to recover. So now within 2 to 3 months, I would say 80 to 90% of men get their full control back. So for that time, they may need to wear a diaper or something like that. So it depends on the quantity of leakage in terms of getting back to normal. But this is definitely quicker as compared to the open approach, and but there is that recovery time is part of the surgery.
So how is it different or better, or if you want to compare it with the laparoscopic surgery?
Right. So this we would call a much more advanced version of laparoscopy, because the instruments are pretty similar. They go in the same way. They are the same size of instruments. Sometimes the laparoscopic instruments are actually smaller. But like I said, laparoscopy, the freedom of movement is only in 2 or 3 directions. While with the robotic surgery, we have a great full 360-degree wristed motion, which is one of the main advantages of this surgery. Second, the magnification of almost 10 times of robotic surgery makes you really very clear about what you're operating. There is a 3-dimensional view. So I'm sitting at the console. There's a double camera for the robot, which gives you a 3-dimensional view. So you're like it's like a virtual reality. You're inside and you're operating. So it's a nice way to visualize things. And there are 3D laparoscopy also, but I think the vision is really good with the robotic approach. And so these allow us to do a very precise surgery and a much more easy surgery for the surgeon. Because laparoscopy, you're standing right at the bedside. After doing one case, your shoulders are totally stiff. You really can't operate again, and it gives over time the surgeon's posture and shoulder problems, mobility problems also increase a lot with laparoscopy. So with the robot, you're sitting comfortably, you're relaxed, you're doing a much more precise and comfortable surgery, and it's advantageous for the patient as well.
So Durbin Vidhi is what they say in Hindi, but it is a little cost efficient for the patients.
It is. So like we discussed, that the cost is not just the direct cost. You look at the indirect costs in terms of recovery, less complications, and less blood transfusions. All those things add up to the cost. And so I would say it is. And with now more and more insurance covering it, I think it's a no-brainer for a lot of these surgeries, especially for the prostate and kidney, that over time there should be really practically no other option other than if it's something else where you need to do it open. But for most cases, I would think robotic would be the way to go.
So these are the reasons why one should be choosing robotic surgery. And I would like to know that for all the urinary bladder cases, is robotic surgery essential or suggested?
Now that's a good one because urinary bladder cancer is a very variable cancer. There are most patients present in an early stage because the most common cause symptom is blood in the urine. So whenever somebody sees blood anywhere, they usually get scared. So a lot of them come quite early, which is a good thing. And so in those cases, we just endoscopically we remove the tumor, and then depending on the biopsy report we may need to give some chemo or immunotherapy, which is basically BCG inside the bladder itself. So in those cases which are early tumors which have not penetrated deep into the bladder, then we don't need to do robotic surgery. But for tumors which are larger or have penetrated up to the muscle, so those are the tumors which can be lethal, and we need to remove the entire bladder in those cases. So in that situation, the robotic surgery does come into play, because removal of the bladder and then making a new bladder or making a separate pathway for the urine to come out, that is also shown to be better in terms of recovery for the patient after a robotic versus an open approach. And during my fellowship in Miami, I was lucky enough to be part of the world's first trial which compared robotic and open surgery for bladder cancer, and we published that in 2018, and that did show much less blood loss with robotic surgery, and a day or two of discharge was hastened after the robotic approach. So these are the advantages, and it's basically for more advanced tumors which have invaded the bladder muscle.
So would you suggest TURP for BPH?
So BPH is a different ball game. It is a benign growth of the bladder, and it happens in all men. So anybody above the
After
age
a
of
certain age,
40 or 50, even my prostate is growing. So I think everybody is going to have, all men are going to have some trouble.
So which one will you choose? Because you said yours is also growing.
Yeah.
So will you choose BPH ke liye TURP or
that depends. Yeah.
robotic?
So I'll tell you what needs to be done. So because that's a great point. So when the prostate grows,
so what you choose for yourself
will be for everybody. So
why I'm asking is this precisely is because my father has
okay.
Yes.
Oh, okay. So so the BPH grows, but it may not always need surgery. So that's the first point. Out of those who have prostate growth, only half will have some symptoms, and only maybe 10% or 15% of that will actually need surgery for those symptoms. So most of the men can be managed medically with tablets and things like that, and a lot of them are quite comfortable taking those tablets for a long time. But once you stop the tablets, obviously the prostate is going to grow back. The second thing is, when do you need surgery? There are very specific indications. One is if your urine is completely stopped, so which is called retention, and the catheter needs to be placed. Second is if that you're retaining so much urine that the kidneys are getting affected.
Yeah, it happens.
It happens. So the urine cannot come down, the kidneys swell up, and that causes trouble. So that's when you definitely need surgery. And third is if there's bleeding or repeated infections in the urine, or if your medicines aren't working anymore and you're fed up of taking the medicines, then you need surgery. Now the type of surgery depends on the size of the prostate. Okay, if it's a very large prostate, so the normal prostate is the size of a walnut, akroot ka. So it's maybe like 10-15 grams. But with age, it grows anywhere from 25 to 250 also. So those prostates which are more than 80 to 100, which are really pretty large, those are best treated robotically, because those we need to kind of remove as much as we can, which becomes very difficult by a TURP, and that procedure can then become very long. The TURP can be 3-4 hours, which again makes possibility of a stricture or a narrowing of the prostate more likely. So in those situations, large prostates, there is a laser approach and there is the robotic approach. So being a robotic surgeon, I would choose that, those which are 80 or 100 grams and above and need surgery. But for the standard cases, if it's smaller than that, I think TURP is pretty good.
Better. And for old patients who are above 70?
For those who aren't fit, because when we do robotic surgery, the patient needs full anesthesia.
Yes.
So while with a TURP, they can be under
Yes,
half,
yes.
they can be awake. So those who aren't fit to take the full anesthesia,
Very important.
yeah, so they would need to be with a TURP or a laser procedure for
So
that.
for patients who are above 70, like my father is 75 and he had undergone 2 years back the TURP. So laser doctor is suggesting. So doctor, usually patients they think कि tumor है तो let's treat it with medication and surgery avoid करने सोचते हैं. But would you suggest that they should consult the doctor and let the doctor decide कि tumor में भी surgery चाहिए या नहीं चाहिए? Because they get scared only when they are told कि cancer है.
Yes. So that's very true. We see that every day that patients are often in denial कि exactly क्या है. So tumors can be of two types. Some tumors are benign, some tumors are cancerous. So the patient has to be very clear about what they are dealing with, and that is not done by a family member.
True.
That should be done by the doctor about what is the stage of the tumor. Is it a cancerous tumor or something benign growth? Basically, tumor means growth. So growth may be benign or malignant. So it depends on the understanding of the patient, and it has to be shown to a doctor as to whether that is a malignant growth or a cancerous growth which needs treatment. So not all cancers need surgery. Some need chemotherapy, some need radiation. So all that has to be seen in close conjunction with the doctor. It's not कि कोई family member said ये आयुर्वेदिक ले लेना, ये होम्योपैथी ले लेना, exercise, diet change कर लो, चला जाएगा. All those kind of things can be dangerous, because if that delays the treatment of the patient, then we may lose the chance for curing that patient. And it grows advanced. So then we are kind of in a bind. So the earlier we find out about it, the better. And people hear the word cancer and they get very scared. But today, let me tell you that there are a lot of options available. Lot of patients, even with advanced disease, are living for a long time. So, don't get scared. Approach the doctor and try and figure out what is the tumor, what is the cancer, what is the stage, and what are the best possible options. Don't just, neglect it or listen to somebody and,
Become
take a chance.
Doctor.
Yeah, exactly. And take a chance with the health. Yeah, so that's one message which is very important. So thanks for bringing that up.
So, doctor, for our viewers, what exactly is prostate cancer? Tell us all about it.
Right. So, I'm very happy you talked about this, because prostate cancer is one of the most fastest growing cancers in India in the last decade or so. In the West, it is the number one cancer in men. But in India, still we have a lot of gutka and tambaku chewing, and so the mouth cancers are still more common as compared to prostate. But prostate is now going up in numbers as well. So it is almost 1 in 8 men in their life will have prostate cancer. So you can imagine the sheer number. We have probably 500 million men, and if 1 in 8 are going to develop prostate cancer, that's a huge number. Okay, so it's important that we try and find it early, and so we are able to treat it in a curative state. And the risk factors for prostate cancer, one is age. So our population is aging, the life expectancy is growing. So that is one of the reasons for prostate cancer to be rising. Second is we don't know the exact causes. There is a genetic component, because those who have a father or a brother or a kaka, with a history of prostate cancer, first degree relatives, they are very high risk of developing that. And those with multiple other cancers in the family, they also need to be aware of prostate cancer. Then smoking. People will think, what's the connection? Prostate and smoking. I mean, it's miles away. But smoking raises the risk of any cancer in the body, whether it's from the head, nose to the toe. So even prostate cancer risk doubles if you are a smoker. Yeah, and obesity is also one of the risk factors for prostate cancer, and in fact, it's associated with more aggressive type of cancer. So these are the risk factors, and why it happens in men. And what is important to know is that we have a screening test for prostate cancer, which we can then use to catch it early. and this has been shown to reduce death from prostate cancer and spread of the prostate cancer in many studies across the world. So this is called a PSA test, which is prostate specific antigen, and it's just a simple blood test which is done above the age of 50 or 55 in all men. Usually we do it once a year, or depending on the values we can increase or decrease the duration, and it should be a part of most health checkups. But sometimes patients are not aware, or the doctors, the general doctors, general physicians don't order the test, and then we get the prostate cancer in a much later stage. And especially in those who have a strong family history, we even recommend to do this in the 40s. So at around 45 years of age, to assess the baseline risk of that man's prostate cancer. So if you do that PSA test, then the interpretation should be done by the urologist, and then if there are any further tests that are needed, like an MRI of the prostate or a biopsy of the prostate, then the urologist or the uro-oncologist would take that call. So try and include that test as part of the general health checkup. In that way we can catch the prostate cancer pretty early.
Lifestyle, I guess, is also one of the reasons.
Yes.
What do you suggest that in day-to-day life, lifestyle में क्या हम
change कर
सकते हैं? Exercises,
Sure.
physical activity,
Right.
yoga and all.
Right. So first thing of lifestyle is stop smoking. I mean, that would give up almost all the cancer's risk that you have.
Consuming alcohol also?
Alcohol is still 50-50. There are specific cancers where alcohol is associated,
Okay.
but not so much in the prostate.
Okay.
So those are more gastro and GI cancers. That's second. Third is exercise. So now exercise by itself reduces the risk of cancer for a person. Whether or not you lose weight, that's immaterial. So above and beyond that, just doing that exercise helps you to decrease your risk of cancer. So I generally recommend some form of cardio, so walking at least 30 minutes a day, or yoga, that also helps. So these are the things where, as long as you are active, whether or not your weight reduces, you're still reducing your risk of cancer. Fourth, like we discussed, because obesity is a risk factor for prostate and some other cancers, try and reduce it. I know it's not easy for everyone, but get a consultation with the nutritionist, or try and figure out the best possible way. So, and avoid processed foods, try to eat fresh fruits and vegetables. So these are some of the things which would help in a healthy lifestyle. So we are kind of adopting more and more Western lifestyle.
Junk food and
and all those processed food, junk food. So for whatever reason, they are associated with some risk of cancers in general. So those are the things where we can take some charge of our own health and control the risk of cancer.
Also, doctor, prostate cancer और prostate enlargement में क्या होता है कि यूरिन पैसेज जो है या तो ब्लॉक हो जाता है या रिड्यूस हो जाता है, जिसकी वजह से आसपास की जो ऑर्गन्स है वो भी इफेक्ट होती है.
Right.
उसमें भी रिस्क होता है कि किसी तरह का इन्फेक्शन हो जाए.
Yeah.
तो वो कैसे अवॉइड करें, what all to be taken care?
Right. So prostate, as it grows, it blocks the urine passage with time, and so the man's urine flow will become much less. So a lot of men, they think that their flow is actually good, but it's not good, and they try to neglect it. So anytime you have any of these symptoms, like it's taking long time to start the urination, or long time to complete the urination, or the urine is stopping and starting in between, or you need to strain to complete the urine, or you feel that urine abhi baki reh gaya, andar pura khali nahi ho pa raha hai, ya bar bar jana pad raha hai. So these are the symptoms where you need to approach the urologist to kind of make sure what is going on. Don't wait too long. Try and get investigated quickly, because the PSA, the sonography can give us some kind of idea about what's the problem. Sometimes if the urine stops, then the catheter will be needed. So that's an emergency. Or if too much urine is remaining, the kidneys can get affected, infections can happen. So these are the things which we want to avoid. So go early to the doctor. Men above 55, get your checkups done so that you know at least what's going on, and then you can monitor it as per the frequency that is needed. And rarely, if the now unfortunately it's not rare in India because nobody knows about prostate cancer, but we still get men who come in an advanced stage of prostate cancer, where the cancer has already spread. So it can go to the bones is the most common. So sometimes they come with a fracture और फिर बाद में पता चलता है कि it's because of the prostate cancer. You know, so that's the kind of stage where we see still, unfortunately, in India more common than a early cancer.
That's how serious it is.
Yeah, that's how serious it is. And even then, men today we are. So जब मैं पढ़ाई कर रहा था 10 years 12 years ago, we had only 2 or 3 medications for that stage of disease. Today we have almost 10. So there is a new type of medicine coming out for advanced cases also almost every year. So don't lose hope. There is a lot of options available, and ideally try and get diagnosed in an early stage. But even men who have advanced disease, we can treat them very well today.
So doctor, these days, because of the fatigue of the lifestyle, because of the fatigue of the workload amongst the working couples, the sex life जो है वो बहुत affected है.
Right.
तो sex life affect होने की वजह से या अच्छी नहीं होने की वजह से also it leads to the enlargement of the prostate and later on stages में prostate cancer.
Right. So that's a very good question. So what is important is that a regular sexual activity is needed for the health of the prostate. So there is a couple of studies which do show that having a regular ejaculation protects a man, but whether it's a direct cause of cancer, it's difficult to say, but definitely there has been some protective effect shown. What we are seeing as urologists is often younger men who are in their 40s who come with infection and trouble passing urine, and their prostate keeps getting inflamed, which is known as a chronic prostatitis. Often that is related to a complete absence of sexual activity. So there sometimes I even actually prescribe them कि आपको करना पड़ेगा कुछ. Otherwise this kind of thing keeps repeating. So there is some correlation. Whether it's directly a cause of it, it's difficult to say, but definitely it is important to maintain the health of your prostate.
Good, you give counseling to young men. So if you also have any questions regarding robotic urology, please do write to us on the comments below, and so that we can have another episode with Dr. Venkat wherein we can put your questions and you can have your answers. On that note, thank you so much, Dr. Vivek Venkat, for being there in the show.
Thank you so much. It was my pleasure. Thanks a lot.
My pleasure too.